Well, hello, everybody. This is Paul Feuerstein, editor-in-chief of Dentistry Today, and I am here today with Joanne Jones. And Joanne really needs no introduction because I don't have the time to spend an hour going through everything that you've done in your career, Joanne. But for that one person who doesn't know who you are, let me give a little brief talk about Joanne. Um, and she's really one of the top dental minds in the area of oral health and oral conditions. And you probably have seen her if you go to any dental meeting on probably one of 1,000 different podiums, and you can't even get into the room. The people are stacked up against the back wall. I mean, you're just invigorating for everybody. Um, but interestingly, one of the things that she talks about is being an advocate and an educator for your patients, and telling the patients that they have to have some skin in the game, literally, not figuratively too, I guess. Self-examination between visits. They'll find something, they'll say, I'm not going to be in for another 3 or 4 months, I'll check it then. And we're talking about oral cancer, we're talking about oral systemic issues. And so the patient should have a self-alert, go, maybe I should just stop in and see if something's screwy going on here. So there's so much to talk about, but let's focus on one thing today, which is xerostomia. And I have to tell you, Joanne, I've been in practice for a bazillion years, and I'm seeing more and more and more now. And I'm sort of frustrated because the patients are coming in. They go, I don't understand. Is it my medications? Is it this? Is it that? Why am I having, why is my mouth so dry? And what do I do, Dr. Paul? And I go there, Joanne, help. Help me.
Well, first of all, thank you for that very kind introduction. And I am with you. I've been in this profession for quadrillion years, quadrillion, billion, zillion years, whatever, going on 5 decades, actually. And I've seen so much in my clinical career as well. But the thing that really, the reason I'm here is to talk about solutions, because in a recent survey that was done of dental professionals, there were over 90%, actually 92%, that didn't feel like they had a reasonable solution to be able to provide to a patient. And that's a devastating feeling because, we're there, we're interacting with them. We want to have tangible solutions. That is so, so important.
And
So.
that, and that's the issue is that, they say, well, can I use this specific rinse? Can I do this? Can I put lozenges in? Can I do the, and I don't really know. I really don't know what works, what doesn't work. And then
Mhm.
they go and they change the formulas on these things behind the back, and they say, well, it used to work. So that's challenging too.
Exactly. And I have to admit, I think for years, like my specialty, as you alluded to, has been head and neck examinations and talking about oral and oropharyngeal cancer. And I had those proverbial blinders on where I understood that, radiation is the gift that keeps on giving. And, dry mouth is one of those really, really negative consequences. But I didn't understand a couple of things: the propensity of the symptoms and how it actually affects every facet of life. And I wanted to bring one report to the attention of your viewers, and it's called The Voice of the Patient. And it was something that was born, it was one of those birthings that happened during COVID. And it came out, it was an interactive streaming that was done in, I think it was in the summer of August, don't quote me, but 2021. And then the report was actually published February 2022. Honestly, Dr. Paul, if you read that, I would challenge you to not be emotionally moved by it. These people that are sharing what I feel mistakenly minimize by calling dry mouth. I mean, dry mouth, it's like sticky foot or whatever. It doesn't have, it doesn't grab you. And these people were talking about the social isolation they feel because they're scared to death of choking in public. They don't go out to restaurants. They were even talking about the lack of intimacy that they have in their lives because of halitosis, because of a dry mouth, dry, cracked lips, all of those things. It's staying away from recreational activities. And the interesting thing that broke my heart is over 50% expressed anxiety and depression, and yet only 2% actually use depression meds because of the dry mouth or the xerostomia
Wow.
adverse effect from it. I mean, that in itself is sad beyond a level of comprehension. It's debilitating. And you know,
It's
especially
almost
during.
contradictory to take the solutions causing the disease, it's causing a significant increase in the problem.
Yes, exactly, exactly. And you know, and another reason too, with those blinders on, that second part of what I was saying is the fact of, you know, looking at radiation and its impact. Anybody that has had head and neck cancer treatment, or a family member or someone in their circle, patient, whoever, understands the gravity, or the brevity, I should say, of the situation. But it's not only that today. Over 30 million people using CPAP machines. Another consequence is, of course, dry mouth. Polypharmacy, something I read the other day that just blew me away. You know, we think that we kind of have got into a decline of the use of tobacco products only to see vaping, you know, hugely soar. Now we've got something called a nicotine pouch. And nicotine pouches, not only high concentration of nicotine, but way back, like about 2019, just to give you an example, a point of reference here, there are about 125 million units that were sold, and mostly to our youth. Now in 2024, over 800 million. So 8 times, and these, of course, are causing dry mouth. So when you make that statement, I'm seeing it so much more. Yeah, it's way, way out there. Diabetics, Sjogren's, everything.
And the challenge as a practitioner was this multi-level. So as a dentist, we see it, and our concerns are major initially. Look what's happening to these teeth. I mean, what's going on here? They're cracking off, they're breaking, they're this, they're that,
Yeah.
and so there's the it's impacting the oral health itself. But what you're pointing out is it goes way beyond that. It goes into a social area.
Yes, exactly. Exactly. This whole social isolation and all the other facets of it are just debilitating and affecting every aspect of life. So, you know, that's why I have now moved into lecturing and speaking a lot more and doing in-depth research and finding out what's out there. You know, let's talk solutions. That's what our profession is really looking for. They understand that, yes, there's a multifactorial etiologic pathway that is leading to this, and they're seeing a lot more prevalence. But when the rubber hits the road, what are the solutions? What can we recommend with confidence? So that's,
And one other thing I notice is sometimes we see it as the practitioners, we see the dry mouth and the patients really, and they don't even some of them don't. I mean, they're not devastated with it. They don't, but they don't understand. And they're coming in with cervical caries and things, and they say, you never had this before. They go, I don't know, and so we're responsible too to from a diagnostic standpoint to say this is a significant problem, and can we let's check out your meds, let's check out this, let's check out, see what's going on, what's changes, what are your changes. At least, and I'm
exactly.
not a physician, but I at least can say, could you check with your physician on ABC? So we have to be as alert too, because we know this term dry mouth. People just think it's, oh, well, my mouth's a little drier than usual, but they don't really think
Yeah.
much about it. So it's an educational piece too.
Exactly. And that's where the onus is on us as healthcare professionals to, you know, at the very, very minimum, have that question in our medical history intake that, you know, how often does your mouth feel dry? Never, sometimes, usually, often. You know, if somebody talks about nocturnal or just having that dryness at night when they're sleeping, wow, like red flag, that is huge. And the responsibility on us as we're discussing, you know, possibly an elaborate treatment plan for restorative or aesthetic interests, we need to be educating that patient about what's going on in those 6 hours, 8 hours, 10 hours that they are sleeping and how compromised they are going to be. So that's another really valid point.
I'm not putting you against the wall, but what are some simple solutions for some solutions quotes? What are some simple solutions for the patients? What can they do at least visually at the start before we get into some deep?
Yeah.
I mean, what's out there? Really, what's out there?
Very minimal to start with. There's a number of things. Like, first of all, you know, educating the patient, having information available to give to them, to avoid the obvious irritants, anything that is going to dry their mouth further, like obviously minimizing the use of decongestants and antihistamines wherever they can. Some of their food preferences, avoiding things that are salty, obviously that are going to further deplete that salivary flow. Anything sticky, sugary, hot, spicy type of foods are so important. Using a humidifier at night. Simple things like coconut oil. Coconut oil is a great one. It's not expensive, and lather it on, use it over the tissues themselves, and help yourself that way with a simple, kitchen pantry item. So there are simple ways when somebody is mildly dealing with xerostomia, but what about the patient that the chief problem is that they're a mouth breather? And this one I say with caution and always seek medical advice. But even, some people have very effectively used micropore, the 3M micropore surgical tape. So they put a little bit of tape across their mouth that is porous enough that they're obviously able to get air through, and then used a breathe right strip across the nasal passages that is going to change that anatomical configuration within the nasal passages to allow a better flow of air. So these are things, I'm going to give a shout out to Dr. Mike Milligan, who is a cancer survivor himself. And I know you probably know Dr. Milligan very well. But he has a great PDF that talks about some of the solutions that he found were most helpful to him when he was going through his nasal pharyngeal cancer.
We should be able to post that link. So if you get me the link after we talk, we'll make sure we post that.
I will, for
That's
sure.
great.
I want to give you that one. I'm going to come back to solutions, but I want to give you that link. And also, if you wouldn't mind posting when we're talking about, okay, how do we assess this chair side? There is a really good scale that was developed by Professor Stephen Callicombe from England, and it's called the Callicombe scale. So let me see if I can remember the phonetic alphabet here. Charlie, Hotel, Alpha, Lima, Lima, Alpha, Charlie, Oscar, Mike, Bravo, Echo. Got it. Okay, so the
Oh,
Calcombe scale. I'm going to give you that link as
that'd
well.
be great. I mean, because
That's a
this
great
is
one.
this is important. What about things like high fluoride toothpaste? I don't want to use a brand name, but I have to. Something like Prevalent or something like that. Are those
Yes.
helpful for xerostomia though?
You know what? I'm going to go to my list because I don't
Okay,
want to forget anything.
sure.
And I am going to give a shout out to a number of different products that are out there. First of all, are xylitols.
Right.
Xylitol, Xylem melts as well. If you're not
I've
recommending
actually
Xylem
used those.
melts, what was that?
I've actually used those. They're easy.
I know they're wonderful, and the interesting thing about xylitol is it actually has a neurological stimulation capability that a lot of people don't understand. That it activates the receptors of our major salivary glands. So the innervation is actually happening at that neurological level. Don't ask me to go really deep on that one because that goes,
We don't have 2 hours.
yeah, and we might lose everybody regardless. But the xylomalts are great because it's got that bioadhesive property.
Yep.
It's going to be a slow release through the nighttime when the patient needs it the most. So that is a really good one. And of course, we've got Xylear, the spry products, 3M, Theramints. There's a number of products that are out there. I would guard your viewers against going with an over-the-counter product that does not have the therapeutic 1 gram dose. That is important. So xylitol is going to starve the strep mutant. So the opportune
Right.
time is to have that after a meal or a beverage. Another one I'm going to give a shout out to is I could not stay away from it because it tastes so darn good, is Basic Bites arginine carbonate, bicarbonate. It's a pH stabilizer. Comes in a wonderful chocolate flavor. I think there's another flavor as well, but I tuned it all out after I heard of chocolate. This is a soft chew, used twice a day, in the morning, after breakfast, and before bedtime is an opportune time. And what this does is it stabilizes the pH because we've got to remember dry mouth, they're going to have an acidic environment. So this is just, again, wrecking havoc. Baking soda. A simple baking soda rinse is something we should be always recommending for the xerostomach patient to bring that pH back into neutrality again. So that's a good one. Um, the
Just so you
elevate.
know, I'm going to post all this. I'm going to post this right below the video, so we'll have all these things down there. But
Okay,
yeah,
I can send you a list.
sure,
You don't have to worry about taking notes.
I am.
I know, but if you want me, I'll send it
So
to
that's
you as
fine.
well.
Great.
Elevate products, the all-day products. So
Yeah.
they have a patented muco-adhesive property to them. So they have more retention. These are most of these, well, all of them that are over the counter that are sitting on our shelves are all water-based. So that's important to remember. So water-based doesn't have that sustainability and they have to be used quite often. But all day does have that added benefit. Salivia, another one, 6 natural enzymes. Because remember, when we lose saliva, I told you I could talk a lot.
That's fine.
I will take a breath here.
No,
But
no, no.
when we lose our saliva, we're losing more than just moisture. We're losing a lot of healing enzymes and other facets of it. So a lot of these products, there's no magic wand that treats everything, but a lot of these products can be used in a synergy and be able to complement one another. So Salivia it's water-based again, has 6 natural enzymes. Saliva Max, prescription-based. It's a super saturated calcium phosphate sachet. So this is like a powder rinse, a little bit less convenient than some of the other products to use, but it does have some sustainability they talk about with severe xerostomia that they actually have about 70 minutes or so of relief that is accomplished. So it's something that you would use repetitively if you were in a severe
Sure.
situation. Ginger gel. Ginger gel, always recommend this one as well. Hyaluronic acid, really healing in a dry mouth situation where you've got opportunistic viruses, not viruses, but lesions that have caused like candidiasis, aphthous ulcers, things that our patients with dry mouth are often experiencing. So ginger gel is a really, really good one that brings that hyaluronic acid that is normally found in our bodies and produced by our body, but drastically reduced when we have inflammation.
Wow.
So it's a good one. The last one, but certainly not least, and thank you again to Dr. Mike Milligan for making me aware of this because it was on the market, went off the market, came back on the market, thank God, because it does have a competitive differentiator, and that is a coral. A coral is lipid based. When I found out it was back on the market, I reached out to the company because of the fact that that differentiator, making it lipid based, has the ability to create a barrier, trap moisture in, retain moisture, and protect the tissues. There is a palpable difference. It is prescription based. It is available through an online pharmacy or a general practice can provide at point of care. But that one is definitely worth checking out. So as you
Wow.
can see, we got quite a few products out there that we just need to have an opportunity to get the education and to disseminate the information, say, okay, these all, a lot of them work in different ways, but they have a synergy to be able to bring comfort and restore hope, basically, to our patients that are struggling.
No, I mean obviously it's a frustration for them too. I mean,
Yeah,
boy, wow.
totally.
I got a lot of homework to do.
Well,
This has
I'm
been,
glad you learned something.
yeah,
That
oh
makes it
no,
valuable, right?
people have, but one of the pleasures of being this editor position, which is kind of new to me in the last few years, is I feel like I'm in school every day. I get articles handed to me, and I'm reading things and go, I never knew that. I never knew that. So this is for me. I'm in CE 24/7 just about.
That is awesome. You know what? Just got to tell you a very quick funny story. I was doing a lecture and a young dental hygienist, of course, they're all young now, but young dental hygienist came up to me and she said, Joanne, I just love your enthusiasm for your profession, which was a lovely compliment. I wish she just left it there. But then she said, how do you stay so enthusiastic when you're so old?
So that's actually that rings true for
Okay.
myself. I've been seeing patients, I have to say, for 50 years. And they look
Yes,
at me and they go, why are you still doing that? I said, the day I lose my enthusiasm is the day I'm walking out the door.
exactly.
And people don't get that. They say, well, what's your agenda? And I'm just entrenched in this. I mean, I'm nuts. I don't play golf, so that's part of it, I guess. But
Well, it's probably less frustrating life for you.
I mean,
But
I
you know
have
what
nieces
you're.
behind me too, so I mean, I have my own crutches, but no, that's the truth. And there's a sense in the dental community right now, the younger dental community, that who are all these old people out on the podium? But they don't. But then they come and they go, wow, I can
Mhm,
I want to hear this 30, 40, 50 years worth of information,
exactly.
and
And that's
it's
the
really
key.
helpful. And
That is the
and thank
key.
you, Joanne, too, by the way. I mean, for everything you've been, you're just diving into these things and opening doors for everybody to look at things, and it's you're just wonderful. I'm sorry, I had to
Thank
say
you.
it.
Thank you. Well, you know what? The key is lifelong learning, exactly as you say. And one more comment that I want to make, because I know we could turn this into a
Yeah,
3-hour session.
yeah.
But one more quick comment that I did wish to make is that lifelong learning, as I say, is the key. And I just had a fabulous conversation with a doctor. She is a leading physicist and world-renowned scientist who is the inventor behind a very, very interesting product called ZomaGuard. XOMA. I'm not going to do the phonetic alphabet again. XOMAGUARD. And this is an oral appliance, no wires attached. It gives a calibrated release of saliva-like moisture that mimics the salivary flow when a patient is sleeping. So I'm very excited to see the future of
So
how
we
we
have
be treating xerostomia.
Yes, there's a real crystal ball here. So I mean, I guess and it's up to you and me and everybody else to make this awareness out to the world, so we can find these special people who say, "Hey, I have an idea." I mean that's what makes it work. Well, Joanne, I'd love to go on for another hour, but you know, I hope you're still with us. So if people need to track you down, you have a wonderful website. So why don't we just get the website address? Very simple, I think.
Sure, Joanne Jones. My mother did give me the hyphen and the A and the E. So J-O hyphen or dash, J-O dash ANNEJONES.com.
And
And
it's a great
yes,
website. It has a lot of information on
thank
there.
you.
Plus, if any of you are interested in having Joanne come to speak for your area, whatever it is, some little nice links and some demonstrations of what you've been doing and different topics. So, I mean, you're just a great asset to dentistry. That's all I can say. I'm sorry. I'm kissing up to you, but there's a reason for it.
Thank you. That is extremely meaningful to me. Thank you very much.
All right, so we'll have all this information. Hopefully, we'll be sitting below this video here, and if not, we'll come up with some scheme to get this all information to you. Joanne, thank you so much for this, and I have learned a ton just in this last 20 minutes or so. Thank you.
Wonderful. Wonderful. My pleasure.
All right, take care.